To discuss unlocking the medical benefits of cannabis, we have an all-star panel, and to lead us and moderating that panel, biochemist researcher at the National Institute of Biology in Ljubljana. Please welcome Professor Dr. Tamara Laternshek. Use the microphone. Use the microphone.
Oh, sorry. A panel
Yes.
on medical use of cannabis. We have heard now how it's produced. And for this reason, I would like to invite my dear colleagues, which is one, David Neubauer, Professor Neubauer, who is a pediatrician and neurologist, child neurologist, and has been leading the pediatric department of neurology department of the pediatric in the past, or have been was okay. So please. And the second one is the famous pharmacist. This is Professor Boris Strukel, who is internationally recognized and very busy in different businesses and pharma industry and consultant. So he is a professor at the Faculty of Pharmacy of University of Ljubljana, leading Department of Pharmaceutical Biotechnology. So please, let me sit down. Introduction, I would like to say just a few words about medicine, cannabis in medicine. And we know that it has been used in medicine for thousands of years. Thousands of years in many old but civilized cultures, and actually started all in China about 500 years ago. But then the really renaissance of modern cannabis medical sciences was done in Israel. And the leading scientist was Raphael Meshulam, which you maybe know, and he initiated and of course then motivated several scientists all around the world to researching the properties of cannabis. He discovered endocannabinoid system and the use of medical cannabis by using really state-of-the-art biomedical, biochemical, physical methods to prove that. And of course also bioinformatics. And based on such a solid foundation, there is still a problem how to translate this knowledge to clinics. And here we have problem. Here we have problems, as we already heard a little bit around, and these were the problems that are related to the medical agencies and administrative obstacles in many countries, also in Slovenia, especially in Slovenia, I must say, and unfortunately. And also there is a problem with medical society, medical staff, medical doctors to accepting, to even understand, try to understand the benefits of cannabis, although the science is really showing that it has an effect, and we will hear about that today. So about talking about the history, I would like to ask first, of course, this was used for various diseases. And I would try ask you first, David, which diseases have been discovered first to benefit from the consumption of cannabis products in the history and nowadays?
Thank you very much, Tamara. Well, in the history, it is well known that already the, especially Arabic Mohammedan doctors were using cannabis for different purposes, but especially for the seizures, because at that time, for epilepsy, there was no other medication. In the end of 19th century or in the beginning of the 20th century, first medications were bromides and soon after that phenobarbital, and this was actually a kind of help for these patients with the severe epilepsy problems. However, already at the end of 20th century, there were some just few reports about possibility to use cannabis for the severe epilepsy patients, for those with very resistant epilepsies. And at that time, maybe we already had pharmaceutical 30 or even 35 drugs, which were quite effective, but still 1/3 of the patients will remain resistant to all this treatment. So I think pediatric epilepsy was the first one to merge from this medical cannabis treatment, and it was in 2014 actually, that the mother of young Charlotte, who had severe early epileptic syndrome, which is called Dravet syndrome, and she had for 200 or 300 seizures per day. And she went to Stanley Brothers in Colorado, and she asked them if they can produce a kind of oil from the cannabis for her daughter. And it was actually a miracle, because within 10 days of this treatment, the girl has become nearly seizure-free. Instead of 200 seizures per day, she had only 4 or 5 per week. And thereafter, it came to the public in some newspapers and so on. And from that time on, the research on cannabinoid treatment for severe resistant epilepsy started.
Okay.
We have used cannabidiol from 2015 on, so this is for the last 10 years, and already at these early years, 3 years after that, we have published a paper with a retrospective study, and we were astonished when we analyzed the data. 1/5 of our children was completely seizure-free, so 20% were seizure-free, and 1/2 of the patients, they had only occasional seizures, so it was a remarkable result. And soon after that, also the other studies confirmed that.
Yeah, that's really amazing, especially for the families or mothers, and especially then for the children that can grow, learn, and get into a society. Now, I want to ask you also if this is first disease that was FDA approved also, or were there others?
Yes, the majority of the studies, maybe I can just show some comparisons. Here is one systematic review, and you can see that the majority of these studies, there is, this is our study, and there are also many others. You can see that the results are rather similar in all these studies. And epilepsy is the one which is the most studied. However, in Brazil and in Israel and also in some states in America, they were using also for the other conditions, especially for the spasticity, for behavioral problems in autism, for severe sleepiness problems, and for pain. Of course, pain is also one of the topics which is studied.
This is still used now all over the world, but not only for children.
No, it's for
But
for
then
all,
for adults, the epilepsy is not treated with cannabis, and why is that?
Unfortunately, well, I'm talking about our country in Slovenia. Unfortunately, the neurologist for adult persons, they are very rarely using cannabidiol, even if it has been proven also in the double-blind studies that it is very effective, and also these nice guidelines are giving these recommendations that it should be used as an add-on drug, not as a primary anti-epileptic, but an add-on drug, but they are not using it.
Okay, thank you. Oh, do you want to?
No, there is only one thing more.
Please.
This is the summary of these studies, but what I would like to say also is that there was one study done which showed the comparison between purified cannabidiol, which we are using, and the extract of cannabis, which is, they're calling it cannabidiol-enriched cannabis, but however, there is THC also inside. And as you can see, this is our study, and these are the other study, but when you use cannabis-enriched preparations, the results are even better, which is to some extent, it is normal, because then you have this entourage effect and all this.
Yeah, we are coming to that later on in the discussion with pharmacists. But now I would move to Borut, and first I would like to say that first after China, then also this knowledge was transferred to the east, practically to the India, to the Syria, to Persia, to Greece, to Egypt, and then it came also to Europe. Actually, first it came from India by the medical doctor and chemist William O'Shaughnessy, and he was also working in India for a long time, transferred this knowledge to England, and there, soon after that, it was already in English pharmacopoeia, and also in American pharmacopoeia, and even in Yugoslav pharmacopoeia, as I learned today, for several years, until, of course, we all know that prohibition came 100 years ago about, and since then, of course, and now recently, it's again in European pharmacopoeia. So what does it mean? Because Slovenia will also accept European pharmacopoeia. How would this change the attitude to prescribe cannabis, to use cannabis, and especially among the doctors?
Well, thank you very much. First of all, I would like to thank the organizers for giving me the opportunity to be here, and Tamara, excellent moderator as usual. The same faces, the same audience, second or third year, but what is new? Actually, unfortunately, not that many. I'm going to emphasize that I'm going to talk as a pharmacist, so I have to advocate some kind of pharmaceutical legislation, but on the other hand, I would like to put a very big black spot on this regulation, particularly in Slovenia, in order to move forward with what we're talking about. So you have to know that scientific evidence are something, but clinical studies, approved clinical studies, recognized by FDA or EMA in European Union, it is something different. Nevertheless, we'll come to this later on. Now, finally, we are faced with the European Pharmacopoeia monograph on the flowers of medical cannabis. It was issued on July 1st, 2024, so very new document. And yes, we have this document. What does this mean? That all medical cannabis that is going to be produced in Slovenia or imported from any other countries have to completely fulfill with the criteria which is in this monograph. This is good, but let me tell you a very recent example. One of the pharmaceutical company, wholesaler, distributor, asked, this company apply for the permission for import cannabis. Which cannabis? Medical cannabis from Bedrocan. You all know that this is the golden standard in the European Union. And the monograph was prepared according to the characteristics of this plant, which is very well standardized with the content of 22% of THC and other components. And what was the answer from agency? It was a negative one. Why? Because the certificate of analysis from the company that produced this Bedrocan, there is a slightly modification in the ash, residual ash and arsenic, but we're talking about 0.0005 instead of something like that. So extremely rigid. And this is the take-home message. Many times I emphasize this. If there is a will, there is a solution. Is there a will from the regulatory point of view, we're going to get a solution. Okay, so coming back, yes, this is fine. We have now monographs. So all importers or producers, by the way, about the production, it was excellently presented by my colleagues from Andrea from Hope Institute. Yes, we are very close to the standardized plant. However, all producers in terms of medical cannabis have to fully fulfill good agriculture and collection practice, which is this the case. So it's impossible to raise the plant somewhere in not controlled conditions. This is something that it is important, you know, that we just passed with the referendum. It was very clumsy one, but never mind. I mean, the outcome is good. So something is important to know. We have to distinguish, sorry, this is not a real question, but just to mention a little bit, we have to distinguish between medical use and recreational use. I am for both. However, we have to separate these because of the conditions. If we would like to have a raw material for the final product in terms of medical cannabis, we have to raise the plants strictly according to good agriculture and collection practice, which is not the case of the recreational one. So coming back, okay, we have this one, and on top of this, medical agency agency for medical products and medical devices ask importers, or any kind of, any individual, to provide a special form, which is called the written request for the needs. And it was explained to us that there are no need to produce or to export, which was also mentioned by Andrea, that actually that the needs are here. I mean that the plants are already available at Oncological Institute. Let me go furthermore, because I'm quite upset on this. What is the document that agency is used for? One single document, it is called recommendation for palliative care for oncological patients. Could you imagine a recommendation? This is the bottom level in hierarchy of the documentation. They do not care about any kind of international guidelines. We have quite a lot of guidelines. And in this recommendation, there are only two indications. One, it is pain, but the cannabis is supposed to be the second line medication, not the first one, in this document. And the second, it is prevent vomiting, prevent nausea, which again means only two single indication for the oncologic patients that are on the palliative care. So this, it is a dust. Let's say, if there is no will, there will be no kind of let's say, some kind of improvement. So what about other diseases, neurological disease, etc., etc.? Okay, I will stop it here and let me.
Yes, because I have many questions. One is also for you about the role of pharmacists, not only suggesting or helping patients that are coming to the pharmacy and ask for help, but even more so, what is the role of pharma industry? Are they somehow, of course, it's a competition. Are they opposed against, or can they perhaps involve cannabis production of cannabis pharma in their lines, or is that what is the situation in the market?
Yeah, well, excellent question. Thank you, Tamara. Pharmaceutical industry, it is not a Caritas or Red Cross. There is always profit behind. And from pharmaceutical, it is not opposed preparations coming from cannabis, but the regulation, it is extremely strict, which means that the pharmaceutical industry has to perform clinical studies that are extremely expensive. Then the whole indications are technology, it is protected. I'm talking about cannabis. It is protected by patents. So these are patents, and we have these products. For example, Epidiolex, which is a composition of CBD, THC, predominantly CBD, 10 to 1 or 15 to 1, something like that. Then we have Sativex. It is a finished product composed of THC, CBD, 1 to 1, 2.5 milligrams. So there are products, but due to the very strict regulation and patent protection, it is very difficult to penetrate this as a product. Pharmaceutical industry, it is for a business. Let me implement this to Ozempic. You all know that this is GLP-1 agonist, which is actually the only indication. It is treatment for diabetes patients. But due to the fact that very pleasant side effect was found out that this is the reduction of the weight, all of us, we are seeking for this Ozempic. This is off-label use actually. And pharmaceutical industry, under the table, produce a lot of this kind of compounds because of the business. Of course, officially, they could say, no, the only indication is this one. So this is not against, but you know, again, it's very, and at the other hand, is this a real profit if several factories are going to produce medication with only 2 indications, which are actually the second line products for 3 these indications.
This is really amazing. But what does this mean for the patients? And of course, this is unethical to the patients because they are actually declined of any treatment, and then they go to black market. And you have good experiences, and maybe this case, please explain us what happened when suddenly the import of Epidiolex was blocked.
Yeah, we have studied a group of children where parents came to us and they were asking us if we can analyze these products which they bought at the black market for children. And we did the analysis, and this is what we have found. Oops. So this is it. Now, if I finished before with the slide where I showed that cannabis enriched cannabidiol is much more potent than cannabidiol alone, like pure cannabidiol or isolated cannabidiol, somebody would say. This is the slide showing how different were THC and CBD contents in these specimens. You can see that even the ratio sometimes was 1 to 100. That means that the children were giving pure THC on one hand, and on the other hand, there were products with a very high content of CBD, and there was no THC.
So these were the products that the parents were buying
yes,
in the black market in Ljubljana, in Slovenia?
Yes, the parents were buying this at black market. We never asked them where did they get it, no?
Of course,
however, this analysis,
analyze them.
yeah, our institute, Josef Stefan, did this analysis, and this is what came out.
So
and together with this, very different concentrations of THC and CBD, and some of them, they are quite dangerous.
This is very dangerous.
Because you know that when you have CBD together with THC, the CBD is counter effect of THC, no? So there will be not so much side effects. And the other thing was that there were a lot of heavy metals and even steroids in these samples. So these data, unfortunately, were not published because the paper was not accepted. But I think this is
not accepted.
I think this is a very important message.
I hope it will be so they can see how unethical it is to expose children or patients to the black market.
Definitely.
But I will now clear something, because we were talking, and maybe the audience is not really acknowledging this, that we talk about medical cannabis, which is the full spectrum, as you said, the broad spectrum or full spectrum, these are differences, and the pure cannabinoids isolated and mixed together. And what is the difference? As I understand, this mixture, medicinal cannabis, is hard to make this kind of therapeutics a randomized clinical trials, as is asked by the doctors, medical doctors, for a drug and for the drugs to be sold. So can you explain what is the difference, and how this, we call this entourage effects of different cannabinoids, different terpenoids, flavonoids in this mixture, extract of the flower, medical flower. So what is the difference and how to
Yeah, thank you for this question. Actually, yes, you're completely right. You know that, well, the composition, full spectrum composition of the cannabis extract, it is composed not only on cannabinoids, there are terpenoids, there are any other kind of plant secondary metabolites. Allow me to compare this with a very well-known remedy, which is it is sell like medicine now, but it was known for the centuries. And this is extract of Valeriana officinalis, valerian. Actually, Faculty of Pharmacy, University of Ljubljana, we performed some studies, but not only we, all around the globe, scientists try to isolate, in particular, I mean, substances like ingredients. You know that for pharmaceutical industry, it is much easier to deal with one compound, one molecule due to the, I mean, analysis, control of analysis, standardization, and so on. Okay, so it was found out that, okay, what we analyzed, so there were valerianic acid, essential oils, valipotrates, flavonoids. If we test, not only we, but this was the consortium, yeah, exactly, all around the globe, the effect, what is the effect, what is the supposed to be effect, sedative effect, let's say some kind, yes, as a sedative, as an anxiolytic and so on. You know how valeriana is work. Okay, so we found out that not more than up to 5% of these effects were exposed by a single component, separated
from the mixture.
Exactly, which means that the mixture really works pharmacologically synergistic. Particularly the same it is with the cannabis extract. Of course, we have to be very precise on which kind of indication we are going to monitor or to go into. But yes, I mean, in generally, I'm in favor to have a full spectrum. But you know what does this mean, full spectrum? This depends on the mode of extraction, mode of application, for example, then the growing condition of the plant, etc., etc. But it's possible.
So, what's the difference between full and broad spectrum?
We call full spectrum if there is THC inside, and broad spectrum if there are only non-psychoactive cannabinoids.
THC. So the THC content is the difference between full and broad. Okay, look, when I stay with you now and go to the future, from the past to the future, what is the future of using cannabinoids or medicinal cannabis in neuroscience, in neurological diseases? What is your vision?
As we have been astonished by cannabidiol use and effectiveness, using it in the resistant, very resistant childhood epilepsies, we have been even more astonished using it. It also, as in the case of epilepsy, also it came from the parents. They actually came to us and they asked them, why would not try a cannabis product, that means full spectrum, that means cannabidiol plus THC, in severe behavior conditions of autistic children. These were children who were having a lot of different antipsychotic drugs. The regular, well, they are also off-label actually, they are not meant to, Risperdal, for example, and quetiapine and so on, But the parents were coming and they said, each drug of these antipsychotics we used, it was worse. So why we will not try this product? And so we said, okay, we have a product which is CBD THC 10:1. So that means 10 times the content of CBD is higher than THC. And let us try this. And it was remarkable, really, because these behavioral problems of autistic children, which can be very, very serious. I have here a video. I hope it will go. You will not hear the voice because the voice is awful, but this boy, he had this temper tantrum after seeing through the window that their neighbor parked the car not on the usual place, but a place beside, and he got this temper tantrum. Yeah, this is typical.
Was so upset.
Yes, yes, he was completely upset, and this is actually typical for these severe autistic children, and sometimes they are also hurting themselves, or even the family members and so on. So this is really, and the results were remarkable, but not only in our small study. There were only 17 children, but there are this year's studies which proved actually the same. This is Maza, the Brazilian authors, and Miller-Wahl, the doctor from Germany. She did a lot of study on Tourette syndrome and tic and cannabis. And this is our own study. And this is the first randomized, double-blind, placebo-controlled clinical trial on 60 children with these severe autistic problems. And it also showed, they all showed, including ours, that these behavioral problems, these severe behavioral problems, can be really overcome by cannabis. And at the end, I will just say that one of our families, the boy is now 17 years old, and they said after so many years of trying different antipsychotic drugs, we have now a time when we can sit outside together and have a coffee in peace, and we are really very happy. And because sometimes you need just a little bit, you know, but for these parents, that means a lot. This is the quality of completely changed quality of life. They can go outside and they can sit together. And
you predict that this will be taken the child, or
yes. I think
his life.
Yes.
Mm. Thank you. This is really an experiment, and I think it's astonishing that also you found this out, as many others, and it will be probably also going to be approved by FDA or our agency. Yes. Our agency, what do you think about that? Would our agency, based on this data, approve such a treatment? So tell us something about the suggestions, how to deal with that.
Well, I do believe that we're in front of something which is called a final goal of all of us. And this is that the patient will be able to get the prescription to go to the pharmacy and to get this or that product based on the flowers of medical cannabis. I do believe that at the agency that now they have all documentation which is needed for production or for, not for, let's say, for importation. And it is stupid to ask about the number of patients that need this one. You know, there is estimation from National Institute of Public Health. It is estimation that 12,000 only cancer patients are regularly use medical cannabis. And the answer from agency was there is no need. What it is needed, it is on the Oncological Institute. Again, this is the combination, this is the comparison that only cancer patients are eligible to get this. So the final goal will be to come to the pharmacy. Now this is impossible. On the other hand, well, not why pharmacy, not because I'm a pharmacist, but everything should be regulated in the whole production chain from the beginning to the end. Let me implement something that many times I try to give this example, and please try to understand me correctly. For example, if you get a bacterial lung infection, what will be your first step? To go to doctor and then to get a prescription with what? Antibiotic, right? And the antibiotic is going to be then delivered to you in the pharmacy. Why not? Look at this. Why not, as soon as you think or you know that there it is, the bacterial infection, why not to moisture one piece of the bread, put on the in front of the window and went for 24 hours, there would be enough aspergillus and penicillium molds that spread the surface of this bread. Believe me, there is plenty of antibiotics inside. Why? Because you do not know the dosage. You do not know the safety. And it is very inconvenient and very ugly to eat this kind of molded bread. So you trust that the final product with antibiotics, which are produced on the same way, they are not put, okay, bread somewhere, but I mean, I'm talking about GMP. But at the end of the day, this is the same. So trust the final product, but allow patient to get it.
That's the goal of the regulation, and I hope, as we heard Met Kaparagi this morning, that the new legislation will be adopted soon. Of course, there will be a lot of discussion, but we are coming to this. And based on the oncologic patients, also the Association of Oncologic Patients in Slovenia is strongly supporting this movement. And I see in the audience Anna Žličar, who is the president of that, and congratulate for all the efforts that you are doing to these patients get a meaningful advice, at least, from the doctors. Thank you. And so I think we are rounding up this session. And so I emphasize here that to catch up with the global advancement in Slovenia, we really must foster, first, a collaboration between science, academia, and clinics on one hand, and industry on the other hand. And this is clearly what we show. So foster the collaboration between academia and clinics, industry on one hand, and also this should be supported financially, but public-private partnership, and this would be more profitable than anything. And of course, we have to be open also to international financial networks to get support for this kind of research, because so far, most of the research was done based on the support of the pharma companies, and the public money in Slovenia nowadays is spent for prohibition first, and then how to prove the drugs are toxic. So the Department of Toxicology in our clinical center, University Clinical Center, is working intensely on that and making seminars and webinars on these topics, not mentioning that cannabis can also help cure some disease or at least help the symptoms to disappear. So also these regulatory experts and agencies should work independently of the politics or ideological obstacles, whatever they are. And so I think that we will soon get to that, hopefully. But we will try to get that with all our efforts and try to get more people involved in our cannabis research development. And so thank you very much for your attention for this.
All right, let's hear it for our panelists.
Now I want to some questions.
We definitely have time for questions. Of course.
Questions.
I'm coming over.
I don't need.
No, we need to hear.
Yeah, I hear you.
I can fill out. Thank you. We was talking now about analyzing of the quality and the percentage of cannabinoids in cannabis plants. So my question is, how big is the problem with cannabis plants diseases and using of pesticides, herbicides, and other use of chemicals in farming? So when you are analyzing those samples, is there, did you find something there can harm the health of using? Because obviously farmers have to use some chemicals.
Of course, they do.
So
yeah.
I would like to have this answer, and please one another more.
Can I answer this first?
Okay.
So you are meaning diseases of the plants. And I think that Andrea would be the best expert on this because she's dealing with plants. And Andrea, do you have any data on the plants, viruses, infection plants, cannabis plant viruses, infection or bacteria or whatever, or the pesticides, the harm?
Okay, thank you. Yes, there are some infections, of course, with viruses, virids in hemp plant as well. They can be treated, let's say, with heat treatment or cold treatment. It's more complicated, like this, so we cannot spray against it. But there are not allowed, let's say, plant protection products in hemp production which are, let's say, registered. But there are some which can be used for ecological growing. So there are some, let's say, ecological products which can be used against fungi, against some, let's say, predator mites, which can be used to strict or to control the other mites and so on. So there are strict regulations what can you use, but there are not a lot of them, which is a general Green Deal in EU not to use plant protection products as much as we can. On the market products, I don't have. I just know what can be used in plant in hemp growing for medical purposes. Yeah. But I don't know what is. If the question is what is going on the market, I don't have those data.
We have some regulations. We can be sure that we can what we buy on the markets for medical
Regulation.
is regulated. Is good use. There's some institutes or will be some institutes that provide this.
I don't know if there's a lot of regulations on the European side on pesticides and whatnot right now.
Maybe we can ask our pharmacists.
Are there?
Well, just
A lot? Lots and lots. All right, well, I'm wrong.
No.
Let's all break into small groups.
No,
and
we
discuss
just need to
about it.
answer this question first.
Well, just allow me to add this very shortly. Well, actually, now due to the fact that we have this monograph, there is also one section about the pesticides. So as soon as you are going to fulfill this, you are free. I mean, you are on a safe side. So don't worry about this now. Before, it was the responsibility of the producer. But again, there is a general legislation in Europe, as was said, which pesticides are permitted, currents, and so on. But yes, now we have it.
So what is your second question, please?
May I just add this before we are going forward? So if you buy, let's say, the hemp, so cannabis with ecological, biological certificate, before you get it, you have the control. There are a few, let's say, organizations in Slovenia which are doing samples, so blind sampling of the samples. They are doing the analysis, and you cannot get the certificate if you're not following the regulation. So there are few institutions which are covering this, so you cannot get their certificate very easy.
Thank you.
And the second.
Before we get to your second question, we'll get this one. You're good? Okay, thank you so much.
Okay, thank you. And
Hi, good day. I have one question for
Please do.
Professor David. We are producer of CBD oils for many years now, and one parent with a child who is your patient come to us and ask for advice. And we created one oil which is 30% of CBD, 10% of CBG. And in the beginning we had some positive results, but then we tried to create something better. Then we add terpenoids, 1% in that oil. So after that we get way better results. So my question is, do you have some data, some knowledge about terpenoids that can help to calm the child? Because we know that, let's say, the myrcene and alpha and beta pinens are doing good job for now, but I think that there is more room to enhance those medications, but still we are still doing that under like cosmetics. We are doing that regulated. It is really pure. It's by GMP, HCCP, and ISO controlled. It's pure. About I understand those questions that people are asking, and also black market is can't create that kind of purity we can provide. But my question is, what can we do in boundary of the regulations? Now we can do only like cosmetics, and of course you suggest to the parents how they can use it better way. What can we do more to help the patients. Thank you.
Yeah, thank you very much for the question. It is actually a difficult question. We do know that flavonoids and terpenoids and so on, they have a very good effect. It can be a calming effect or just the opposite, no? And Professor Rousseau, the famous neurologist, he did a lot of studies with these different chemovars and with the different extracts of different terpenoids concentration inside. And it really, sometimes it adds the effect to the cannabidiol and to THC, and sometimes it can completely change the effect. However, we are, for the time being, we are not able to analyze it, and even it will be very difficult because we are always calculating the dose according to the patient's age and the patient's weight. However, but calculating only cannabidiol and THC. If we would go further and include the terpenoids, maybe it will be, in the future, it will be definitely something much more effective.
Like clinical studies or something. So I think we are late, and
No, we have some time.
we have time.
We have
So
like 2
another-
minutes, right
2
here,
minutes,
right
all right.
Hi, I'm Andrea Petri. I'm the CEO of Alcos Bioprod and Hammed Pharma, together with Daniel Hanganu, with the president of Hammed Pharma. I want to ask you a question, Professor Borut. We have done in Poland and in Romania CBD as alimentary supplement. Do the government of Slovenia accept on mutual recognition to notify this product as supplement?
Well, no. The answer is no. Why? Because simply CBD is still, you are talking about CBD, right?
Yeah, we're speaking about the full extract, full
okay.
entourage CBD.
Yeah. You know that EFCA, this is still pending situation with EFCA regarding the CBD. CBD is supposed to be a dietary supplement or a novel food. At the time being, it is not clear answer, and due to the fact that the agency, I'm not talking now about the agency for medicinal product, but about some kind of unit dealing with dietary supplements. They are very strict in terms of all regulation, in terms of European Food Safety Authority. It's not still any kind of decision whether CBD, it could be a dietary supplement. So now, which means, that's why it was said that it was like a cosmetic. This is the mimics, right? We all know, but this is the only way. In Slovenia, strictly according to the legislation of European Food Safety Authority, CBD is supposed to be a novel food because it was consumed after 1997. So I would say no, but try. Okay.
Fantastic. That's all the time we have. Let's hear it once again for all our panelists. Dr. Turnchik, Dr. Strupel. Very informative.